94% of people knowing their status, 86% of those who know their status are on treatment, and 92% of those who are on treatment are virally suppressed. But there's still a lot which we need to do to make sure that we can actually, in the next 3 years, reach 95% across the board for knowing your status, being on treatment, but also making sure that we are virally suppressed. The results from districts, some of the districts, are nevertheless not at the same level as it is across the province. Districts such as Harib and Lijweli-Putswa, they're still lagging behind, and we need to catch up. It's even more concerning in that we need to intervene to create a balance amongst these targets in order to reach our 0 new infections by 2030. What we need to do, it means that we need to bring more services closer to the people, closer in our health facilities, but also in terms of outreach programs, and make sure that we do have the resources in terms of treatment. Now, I have been assured by our team here from the province, but also nationally, that at the present moment, our leaders from SANAC and all the leaders from the civil society, from the private sector, at the present moment, and also thanks to our partners who are giving us support, PEPFAR, Global Health, and all the others who are giving us that support, we don't have a problem in terms of actual availability of antiretrovirals. So what we need to do is more to make sure that we can test more people and make sure that we can reach out to them and start the treatment. At the present moment, we don't really have a major challenge in terms of actual availability of ARVs. Despite the fact that our country's HIV prevalence has been going down, as already reflected earlier on, from 2010 up to where we are now, almost over 45% reduction, we still have a very high prevalence of 13.5%, which has been the same over the last 5 years. And that is so because the number of people, as the population increases, the number of people who are HIV positive is still growing. So that's where we need to stop. We need to close the tap at the level of new infections. So the path that our country has taken, as well as our contribution to the mission of achieving the objective of 0 AIDS-related deaths, we must make sure that we reach 0 new infections. But also we must deal with the stigma, we must deal with the prejudice, which a number of speakers have already spoken about. In the past year, KwaZulu-Natal, Mpumalanga, and the Free State Province had the highest prevalence of HIV. KwaZulu-Natal at the prevalence of 18.3%, Mpumalanga at 15.9%, and the Free State at the level of 14.8%. While the Western Cape was the province with the lowest at 8.3%, followed by Northern Cape. So it looks like the Capes have a lower prevalence of HIV. Dr. Hopani, your province of Northern Cape is amongst those which still have a lower prevalence, but at the end, we want the 0 infections. So we appreciate those which are at the lower level, but we must all push our districts and provinces to make sure that we can reduce our new infections. The majority of burden of new infections is largely in the Black African community, vulnerable populations, and that's where we need to put our focus. Our concerted effort now needs to address the alarming and substantial increase in the new infections amongst the young population, which is continuing to rise. It's a critical area which we need to all put our efforts to focus on. These new infections occur in young people, especially between the ages of 15 and 24. And these are this is really the wealth of our country, the young people. And according to the research, this is continued to be rising. According to the Tembisa model, the infections amongst young people is still rising, and that's where we need to really put a lot of efforts. In light of these numbers, we need to keep working together across all sectors to increase the level of awareness and also improve messages in as far as prevention is concerned. In this context, we want to applaud the work that SANAC has been doing, and also the launch of the South African National Youth HIV Prevention Program and strategy, which was launched by our Deputy Minister, Dr. Dlomo, in June last year, which contains a strategy which focuses on a 3-year campaign to make sure that we can reduce new infections amongst young people. The strategy focuses on integration of key health and social services, youth development programs, social and behavior change, communication, mobilization, and increased access amongst the young people to products for prevention services. The ultimate goal of this campaign is to reduce infections amongst young people by up to 40%, because it's only if we can achieve that that we'll be able to stem the tide. And also, we need to focus more on young girls and young women, adolescent girls and young women, because they are the most affected. In the same vein, targeted infections, we have established the National Sensitization Training Initiative, which aims to reduce stigma and prejudice, both for HIV and also for TB. Because HIV is more common in key and vulnerable communities than in other sectors of society, our programs are made to make sure that they can be reached much easier and be able to redress this very serious imbalance and bring services closer, especially to our high-risk communities. To sustain our efforts towards ending AIDS, it is critical that we unite as AIDS council structures across the board, from provinces, mobilize across from province, district, and also at the national level. And in this regard, the Deputy President just a few weeks ago called a meeting of all the premiers to recommit them. And we were very happy that on that virtual meeting, almost, I think only one premier was not present. And I was not able to attend the plenary just over a week ago, but I'm hoping that this resulted in more premiers participating in that plenary. So the Deputy President is again calling on all our premiers, mayors, to make sure that they can, increase their commitment in as far as the fight against HIV and AIDS, but also calling on traditional authorities and Khoisan leaders to make sure that this can be achieved. As a government, we are doing everything possible to reduce the effects of HIV and TB. And we have made a lot of progress in this regard, but a lot of work still needs to be done. In the past, we know that, as already reflected by the Premier, being tested positive for HIV was almost a death threat. But today, with all the available treatments, and we keep on improving with our scientists and researchers, the efficacy and also safety of our treatment. All the time, even now, we're introducing new regimens of treatment which are much more effective and much more safer, with less and less side effects. And we want to encourage people to come forward to get these treatments so that we can all be able to live a longer life. And also, as already indicated, I think it was by the US ambassador, that when you are taking your treatment, if the viral load is suppressed, you also don't pass the infection. Today, we can congratulate the country in the sense that with this intervention, more than 5.7 million people are on treatment and living a healthy life. And we want to make sure that the over 1 million who have not yet reached, we should be able to find them and make sure that they can be also be able to be put on treatment. We need the support and collaboration so that we can be able to eliminate AIDS as a threat by 2030. Already, I think my sister here has already, from UNAIDS, has already mentioned the fact that we need to do even better in as far as HIV in children is concerned. We are not doing well at all. While we still have a lot of catch-up in as far as older people, In children, we're only standing at 57% on treatment, which is really a scandal. So we need to do a lot more to get children to be, those who are HIV positive, to be diagnosed, to be tested, and to be put on treatment. We need to do a lot more in totally eliminating mother-to-child transmission. At this stage, it is not acceptable. There are countries across our neighbors. As we speak here, comrades and leaders, just our neighbor here, Botswana, when we were at the SADC meeting just about 4 weeks ago, and also at the Africa WHO regional meeting, Botswana did report that they have totally eliminated mother-to-child transmission. We are very close to elimination, but we can reach it. We can reach elimination so that no child is born HIV positive. We are just at about 0.6% still. So we can deal with that 0.6% down to zero. So that GBV and femicide, we want to say again that we acknowledge the fact that GBV and femicide are also another side of our struggle to eliminate HIV, AIDS, and TB. That the two tend to go together, as already mentioned. A number of young girls who are falling pregnant, teenage pregnancy. Not long ago, we were getting reports from Stats SA of children, girls as young as 10 years, 9 years, who are leaving school. Deputy Minister of Basic Education can attest to that. Now, that's why we have this high prevalence of HIV infections amongst young girls. So, and many of this is because of inequality, patriarchy as well. So this is also related also to the gender-based violence and femicide. So we're saying that equally as we are fighting against HIV, AIDS, and TB, we must equally also commit with all our partners to make sure that we can eliminate gender-based violence. So the dual epidemics of HIV, AIDS, and gender-based violence needs to be really at our target to make sure that they can be eliminated. Now, the bigger issue also is not just access to this medication, but again, the question of stigma still remains very big. And we are very happy that comrades from the PLHIV, very strong, very organized, we must all rally behind the organizations of people living with HIV, because through that we can be able to get more people to feel strong, to can come forward and be tested. As President Mandela once said, many people suffering from AIDS, there are many people suffering from AIDS who are not killed by the disease itself, but are killed by the stigma surrounding everyone who has HIV and AIDS, a close quote. So that is just to remind us that stigma is still a very important barrier in terms of the reason why we are still not able to reach as a country. There are many districts which have not even reached the 90% of people knowing their status. And that the stigma is one of the major impediments, major barriers to people coming forward. So we urge community leaders across our mayors, our councillors, political leaders, traditional leaders to come, and also labor. I'm very happy, as Comrade Losi was saying, in terms of also workplace testing. We must make sure that access to testing is not a barrier in terms of making sure that more people, but you must also deal with this issue of doing away with stigma. So as a government, we are determined to work even harder to mobilize all sectors in order to strengthen our collective response to the dual epidemics, HIV, AIDS, tuberculosis, but also not forgetting our commitment to eliminate gender-based violence and femicide. On this note, I want to say thank you to the leadership of the Free State under Premier Mantombela and all your team. I'm very happy to see that quite a number of MECs are also here, also from the local authorities, from that the leaders are also here. and also from the civil society and also from private sector, Ms. Mama Paseka, the other Mapaseka. I know there are two Mapasekas here. The co-chair and the leader of the civil society. We thank you, but also to the CEO of SANAC and all the team from Team SANAC for all the work which you have done before today. The mobilization, the sensitization, the awareness, and we say that indeed with our commitment, with all our partners, we will indeed defeat HIV and AIDS and make sure that come 2030, we will not only realize the National Development Plan achievements, but we will also achieve elimination of HIV and AIDS as a threat to our health, to our lives. Thank you very much. Re a leboga, ba Vrystaat. Re a leboga.
Just one last thing to do before Kililokol. We are going to give assistive devices to some of our people living with disabilities. We are now integrating, Minister, as Free State. And we want to also thank Vodacom. They donated 3 wheelchairs, which the district will receive. The district manager must receive those 3 wheelchairs. Thank you, Vodacom. Thank you. And I'm going to talk now to the recipients of wheelchairs that come from the Department of Health. Karabo Silakoma. Karabo. And I'm going to request the Minister and the Premier and Mapaseka, Comrade Mapaseka, can you hand over the wheelchairs? Are they here? No, I'm talking about the wheelchairs that actually you gave me I'm talking about these people. We are going to, let me start with the spectacles. The spectacles, Bokamo Soleboho. Alex Mabanyani, Warabe Sising. Why? Okay, kita ho ba tlo fumana di prosthesis recipients El Muipulai o tlo fumana knee support and MJ Chabalala the knee support. Knee support, you just give them the knee support. Is Muipulai MJ Chabalala and El Muipulai. Knee support. Knee support. Give me that. It's for the wheelchair. Karabelo Selemakong. Mama Pelele, Kikopa, you said the devices very fine, we don't have time. Karabelo Silo Makuma Atleham Mazeba Li King Ruvelin Van Veek for the wheelchair. I don't see other recipients here. The wheelchairs. Not these ones are from Wood Mitchell. They are not yet. Only it's a department. I've called Muipulai and Chabalala, MJ Muipulai and MJ Chabalala. Where are they? Chabalala. Ufumana knee support. Can you give knee support for where the man? Or kitty catches. Okay. Then what? The catches MJ Chabalala. Okay. MJ Chabalala. What look at the frame? Chabalala. If I make you chance at all, wheelchair. No, we are done. I think we are done. Bye bang haba thola dintho tsa bona ke kopa district is sorta out this mess. And then ntwe ke tlo etsa hona jwale ke tlo kopa SANAC, the family of SANAC, to come closer to the stage just to take a group photo, and then after that we are done. We will take the vote of thanks from MEC Tsidi Koloi. Before the group photo is taken, can I then allow MEC Koloi to give us the vote of thanks?
Thank you very much, Program Director. Without any waste of time, my task is very simple because I can realize our people are now tired because they had been here since in the morning. Let me first by acknowledging the entire leadership or different leadership that participated or that were present among us. I say protocol observed. But without any waste of time again, let me say, Honorable Premier, on behalf of the provincial government, we feel very overwhelmed and very excited about SANAC in ensuring that it regards or consider us as the Free State government in ensuring that we commemorate this World AIDS Day here in the province. We just like to thank SANAC alongside with the Provincial AIDS Council, Memon Singh, your department, in ensuring that we make this day success. Impact of fetisisa, but it's our civil societies, those who participated today. Let's Marena Aruna Correctional Services. For the first time, Lily excited Hakanakana in this program. And we are looking forward, Honorable Premier, that going forward, as we continue holding different programs around HIV and AIDS challenges, we'll continue doing it. Thank you very much, Rialeboa, on behalf of the provincial government. Let's the artistic of fellow participating. Ba re sa ba bitsang ka mabitso ba re ba hatileng dikhonse re se re phephi letsatsi la kajeno le batho ba bohlokwa haholo le di resolutions and the policies tse ne re bua ka tsona around HIV and AIDS challenges tse leng hore at the end of the day we strongly feel hore those policies will be attended to. Kia leboha, le tsamaya hantle, drive safely, morena wa khotso, a letse hantle, le fihle, le bolokehile, re a leboha on behalf of the provincial government. Thank you.
Thank you very much, MEC. Ke dumela re fihlile pheletsong ya mosebetsi jwale re tlo tlameha re emele protocol e tswe ka mo the political heads di tswe and leadership e teng ya SANAC. Mara before that ko re ne ke tsa announcement ya hore community ya rona e tla remain seated se ke la dijo di tla itlisa mo dutsing teng le tlo alawa leadership after mo premier a ete ka tlo fana ka di president mona le alawa leadership e dutsing kwano e tswe leadership from SANAC e tswe le a tseba le leadership from MECs mare ha le tswe pele ke tsa announcement premier ha le tswe pele a qeta ntho a tlo e etsa mona mara yona le tlo dula le dutse jwalo di tla itlisa ho lona then the role of leadership decide in SANAC ke bona ba tla tswa ha mo premier a qetile a se a tswa and then le ya ka mane mo le lo jella teng but setjhaba ha se dule fatshe se ke la se senyeha and o tlo ba le performance e tla ba teng Mangwani Bongi o teng o tla tlatsa le entertain ha ntse le dutse ke a leboha.
President of Nahau, Stella Uzelapa Mama, Ausa Rebudelamo. Of Kosatu, yo, I am posting on Yatsam Tonasekai. Kosatu, the whole Kosatu. On the stage, hey, but Jim. Where is the minister? Minister of Health? Minister of Health, President. The CEO, how can I leave the CEO behind? Yes, we are releasing Amachubawetu just to symbolize peace. And then, yes, how can you go out there? I came out to peace. I get some Ubina if you entertain Buhansereza, Hotso Pulanala, Freestata, the World AIDS Day. It has been peaceful, dignified. Bafe mabon. Ukai tebo kaparibi tebo ukai. Akabine munate arkatar to entertain chekelema. Renali Deputy Minister Marali Mangata Joleman Hagitsi. Is it fine? You don't mind? Kitalbona Kamarao. Okay. Ntwetse ekese manli malima. Ntwetse. Okay. Okay. Yes, they know what to do. It's free state here. Give them. Okay, tebo and Antosha Kelly. Shapampina Luna. Batu Babu Asen Kids Happy Lewen. Okay. Movie say. I can know. Shapan Trail, Liense Nalun. Omuhau, amojimo. I will tell you, the fellas. I look in. I didn't know it's the next. Dia tseba di tswa jwang. Eh. Dia tseba tsona. Let's go. I will count until 7. 1. Aibo, liasinya nako. Thank you very much. Siyabulela, re a leboha. 2030 re tla be re fentse nthwena. Peace. 1, 2, 3. Way. Akoletse. MEC Khadisha on the stage, please. Mesidi, Memunten, our mayors that are here, can you come in? Kikupalite, Retore, Hubona, Ntaten Tekele Marena, it's free state here. Bafeng Tosa Bonakibana Etsidi, Taten Tekele, Taten Tekele, Go. Kirinta tentekele. Hai bo liense jwang. Ha re le koloti man. Kubabuha. Ba re le nna ke a e batla. Re qala ka minister. Ke tsaba o e apara. Ke tsaba mayors. Ipinele banabak. Tatentekele. Ay, what's the president? Tentekele. Parent. Halala minister, halala warun. The president. Thank you very much, minister. CEO. It's Mapasaka. CDK Mapasaka yan, yamo. Yan, Mapasaka yan. CD Mapasaka kiyo kamrao. President Akosa Tukai. Ay bo rebata dinepe jole lese wang. We want these photos. Tebo wo itsaitsi ma. Wo itsaitsi wa mo mol. Sidu Shotamang. I think it's everyone now. How about Chuli report kalang?
Yeah.
O shota mang? Ke ma shotang? Speaker! Manga o speaker! O ikgaoletse mo. Re qetile. O shota mang? Ready? Yapa. Yapa. Halalawi ni matikisela Mandela halala. Alibongwe. Alibongwe. Ibatawe apara. Isabadi puo. When I went on. Bye bye. But we are
Marisa. Soare. Modimo a sala le basala ngatsama le batsama ya. Bye bye Free State, bye bye. Bye bye Northwest, bye bye. Bye bye Gauteng, bye bye. Bye bye Limpopo, bye bye. Aretsa general ya kwana ni bele Christmas ya monate. Basa nandijo modimo ba fedijo. Basa sebetsi modimo ba fe mosebetsi. 2023 high check at the petrol. Yeah. Mohadi tumelo.
Ne le dule jwalo fela fatshe le khone o tlisetswa dijo mo dintentebo ha ke tsebe tla bua ha sa a le ready o bina ke kopa mamiki ha le teng atle ha ntse o dutse fatshe ke kopa ntshiwa le tshepo ha teboa thewa mona ha batho ba ntse ba ja ha ona mo le yang kopa le dule fatshe ke a kopa.
Bye Bloemfontein. Sound here now, Kaloka. Major. Bye bye Bloemfontein. Yeah. Yeah. Bye-bye.